Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit npteff.com to enroll today so you can pass tomorrow.
Thank you for joining us here on the NPTE Final Frontier podcast. My name is Emily, and today I will be diving into a question which involves the gastrointestinal system. So the question reads as follows. A 55-year-old woman is being seen by a home health physical therapist after being discharged from the hospital for a total knee replacement. The therapist is reviewing the patient's medical history and sees that they have a diagnosis and history of ulcerative colitis. Which of the following symptoms would this patient most likely present with based on their diagnosis of ulcerative colitis? Option A, pain relieved by passing gas or stool. Option B, watery diarrhea. Option C, right lower quadrant pain. Or option D, left lower quadrant pain. And again, this question was asking which of the following symptoms would be most likely occurring with ulcerative colitis. And the correct answer is option D, left lower quadrant pain, since this is the only symptom that would be occurring with ulcerative colitis. Pain relieved by passing gas or stool, watery diarrhea, or right-sided lower quadrant pain would actually all be occurring with Crohn's disease. Now, I want to take some time to review the similarities and differences between ulcerative colitis and Crohn's disease, which are both chronic intestinal disorders. Now, this is a common topic that does appear on the boards exam, so it is important to understand which signs and symptoms are similar, and more importantly, which signs and symptoms differentiate to really set these two diagnoses apart. Now, first, let's review some similarities. Some of the similar signs and symptoms shared between ulcerative colitis and Crohn's disease include diarrhea and constipation, fevers, abdominal pain, decreased appetite, nausea or weight loss, rectal bleeding, night sweats, skin lesions, and those skin lesions can vary, which we'll describe later, and joint pain. Now, let's look at ulcerative colitis specifically. Ulcerative colitis affects the large intestines, aka the colon, and the rectum, and we will have continuous lesions present. Again, that will be continuous lesions. Now, some specific signs and symptoms are rectal pain, bleeding, bloody diarrhea with mucus and pus, low back pain, and that left-sided lower quadrant pain. Now, Crohn's disease can occur anywhere in the GI tract. Some common sites are the terminal ends of the small intestine or the ileum and the colon. Now, with Crohn's disease, we will have skip lesions because, again, remember with ulcerative colitis, we would have those continuous lesions. So again, Crohn's disease will have those skip lesions. Now, some specific signs and symptoms of Crohn's disease are now that right-sided lower quadrant pain, pain that is relieved by passing gas or stool, watery diarrhea, fistulas or strictures, and joint pain or that reactive arthritis. So I hope you found some of these signs and symptoms describing Crohn's disease and ulcerative colitis helpful. Because again, remember, this is a common topic that does appear on the boards, so it's definitely important to understand how these conditions can differentiate or how they can present similar. And in addition to that, it's also a great idea to go back and review some of those other gastrointestinal disorders, such as inflammatory bowel syndrome as well. Thank you very much for listening. For more information on the NPTE Final Frontier, please visit npteff.com. You can go check out all of our social media platforms such as Facebook, Instagram, Twitter, and TikTok. Till next time, have a great day and a powerful tomorrow.